I don't like
You're good. At least you're looking at yourself and not
and
not at
not
me.
at people. Oh yeah, I don't really care about that.
Here, I'll be relaxed. in a second.
You be relaxed. Okay. Where's Miss Parmesan?
She'll be at some point. Yeah. Which is, I'm sitting here, so I'm about to come in. So
Okay.
you're good.
Okay. Good morning and welcome to my speech.
Oh, should I do the announcement?
No, it's okay.
Okay.
I don't need
Yeah.
to.
Welcome to the stage, Senior Sophia Santa Cruz.
Good morning and welcome to my speech. A recent study estimates that 35 people between the age of 18 and 64 die each year in the United States because they do not have health insurance. Since 2002, this number has doubled. The shocking number highlights the serious problem in the United States. Each of these deaths represent a person, a mother, a father, or a friend who couldn't get the medical help that they needed to their financial situation. This is not just a statistic, it's a reflection of the inequality that many people face while trying to access to basic healthcare. This number shows the true cost of being uncovered. Thousands of people are losing their lives not for their illnesses, but because they cannot afford the treatments for it. This reality raises important questions about our values as humans. How can the U.S. call themselves a land of opportunity if many people are dying? Because they can't pay. How many more lives must be lost before we act and do something? The need for healthcare reform is urgent. We need to push for policies that provide equal access to everyone. We must challenge a system that allows profit over life. One of the victims of this national problem is Susan Finley, a mother and a daughter. She lost her job because she took one day off beyond what is permitted by the Walmart attendance policy. She died at the age of 53 in her apartment because she avoided to see a doctor for a flu-like symptoms. She was found dead by her parents. A second victim is Anna Maria Markel, a mother and a wife. She was diagnosed with stage 3 ovarian cancer in 2017. She tried to cure herself, but she stopped. But she started struggling to pay for her care, so she stopped receiving her treatments. She died in September 2018 at the age of 52. Now, I want to ask you, how would you feel if one day you went to visit your daughter or your son and you found them dead because they avoided to see a doctor for flu-like symptoms? Or how would you feel if your mother or father told you that they're going to die because they can't pay for their cures anymore? That's why healthcare should be public, because staying alive is a right regardless of what it costs. Through history, every country has developed a different type of healthcare system, ranging from completely private ones to completely public ones. How healthcare is organized in a country depends on the social, political, and economical status of the country. Over the years, many countries such as the United Kingdom, Italy, and Ireland have learned how to view healthcare as a fundamental right that should be available to everyone, regardless of their income, social status, or employment situation. This new approach has led to reforms that, in fact, the United States doesn't have. The United States, everyone knows, has a private healthcare system that is also deeply influenced by the country's economy and political situation. Before the 1920s, medical care was informal. Doctor went to their patients' houses and just gave them the cares that they needed, and they paid on the moment of when they received the cares. However, this model started changing during the Great Depression, when hospitals tried to give to people pre-paid plans so they could pay gradually and then use this money at the moment of need in the future. The second turning point was during World War II in 1942. All the world was facing inflation. So instead of raising the salaries companies started to offer employee plans as a benefit to their employees, which is still maintained right now in the United States. Health insurance today in the United States, it's a financial way to help pay for medical costs. It helps pay for hospital, doctor visit, emergency care, and treatments, and vaccination treatments. The types of health insurance plans available are family plans or individual plans that you can buy directly from the insurance, employment plans, and government plans such as Medicaid and Medicare. A serious reform happened also at the end of the 20th century, such as in the 60s. Medicaid and Medicare were established. Medicare provides health to all the people over the age of 65 with serious health conditions and prior disabilities. Medicaid offers health insurance to families, to low-income families that have serious health condition or disabilities. In 2010, Barack Obama tried to open a little bit this vision of Medicaid with Affordable Care Act, also known as Obamacare. This law expanded the people who could access to Medicare. Established Medicaid. Established place where individuals could compare every health insurance plan and try to choose the best one for them. And also push the insurance company to accept the people with prior disabilities. This change amplified but didn't change the public health care sector. In 2024, we have still 27 millions of Americans that uninsured and other millions that underinsured. On the other side of the world, particularly in Europe, the idea that healthcare as a public service became popular immediately after the Second World War. Most European countries began established their welfare system to provide essential services such as healthcare. In Italy, this led to the formation of the National Health Service, where patients receive free care at the moment of need. The patients do not pay for any of their services at the moment when they go to see a doctor or when they are in the hospital, but they pay through general taxation. This ensures that every citizen has the same level of medical attention regardless of their income. More than one country around Europe follow this kind of system, emphasize that the idea of healthcare it's a right and not a privilege, and should be equally for everyone. In public health system, the government plays a major role in terms of funding and regulation. These models are different for each country, but the meaning is the same. Every citizen is entitled to all services regardless of their income or social status. Healthcare in the US is based on combination of private and public sectors, as I already said. In contrast, many European countries, including Italy, France, and the UK, have established public health systems financed by taxes. This system works to provide universal coverage to all citizens and residents. A 2023 study by Lemstor analyzed the World Happiness Report to explore the correlation between happiness and healthcare. It shows that countries with universal healthcare system comparing happiness scores with health parameters such as life expectancy and access to healthcare. In the top 3 of the happiest countries above all this 84, we have Iceland, Finland, and Denmark. All of them have public healthcare system. This result led us to understand that access to healthcare plays a major role in terms of happiness. A universal system relieves the cost and reduces the stress on the citizens. Iceland, for example, leads with a score of 7.5 out of 10 and has a better life expectancy and happiest score. While the US is far below in both life expectancy and happiness with a score of 6.9. The most significant strand of public health care is universality of coverage. These systems are designed to ensure that no one, regardless of their income, professional status, or social situation, is denied of essential medical help. These universal access help to minimize disparities typical of private healthcare systems, such as the U.S., where individuals who cannot afford private healthcare do not receive the treatments that they need. Despite having one of the best advanced health systems in the world, millions of Americans are still underinsured or uninsured. A study by American College of Physicians has showed that Americans who remain underinsured tend to skip their routine appointments. That will lead to a more expensive treatments later at the moment of need. On the countries countries like Italy and the UK provide access to their citizens all the time and push them to take checks and routine appointments. The second strand of public health system is their cost control. Privatized health systems often sell drugs at relatively high prices. On the other hand, countries like Italy or UK negotiate the price with the government to reduce the cost considerably. A very specific example of cost control in the public health sector will be the price of a common drug, such as Tylenol. A box of Tylenol in the United States costs between $10 and $12. In Italy, it will cost just around $4. The sharp contrast is the result of the power that a government can have on the health sector. Although the United States invests more than any other country in healthcare, but its healthcare outcomes are still bad. The US is still behind these countries in key of health parameters, as I said, life expectancy and infant mortality. Public health systems also tend to be more effective on containing health costs. A third and final strength of public health system is the quality of care provided. Although some people are criticizing it, most public health systems in Europe surpass the US in health outcomes. French public health is entirely at the expense of residents through taxes, including consultation with specialists, checks and routine visits, hospital service, and medicines. But their life expectancy is 82.5 years. In the US, it's just 70.5, which is 12 years of difference. The first weakness of public health system is that they're financed by taxes. Everyone thinks that by this, European citizens pay higher taxes to keep the health system running. But the UK, for example, in the UK, general taxation accounts about just 30% of the income of a citizen. That percentage provides the funding for the National Health Service. However, if European citizens can pay more taxes, they don't have to pay for insurance or they don't have to pay for service at the moment that they need to. While the US may have lower taxes, but they have to pay for insurance and cash costs to maintain the economy stable. By comparison, the United States spends much more on private healthcare than other states, but they're both low on access and outcomes. A second weakness of the public health system is that for non-urgent case, there is a possibility of waiting for a lot of time, countless hours. Patients for minor surgery can be placed on waiting lists that can last months because the need is huge and the resources are really scarce. To this end, many of the countries with public health systems, such as Italy and Sweden, have reduced waiting lists by introducing more efficient management practices. Often uninsured people wait for their condition to get worse to go see a doctor, which will lead to more expensive cares afterwards. The third public health deficit is inefficiency. Sometimes bureaucratic system can delay the delivery of the care and add unnecessary administrative costs. However, when compared to the US system, data shows the European public health system tend to produce better healthcare outcomes for every dollar spent. According to a 2021 study, an administrative cost accounted for more than 8% of a total health expenditure, while in the United States, while in the UK it's just 3%. As a result, public care has several advantages: universal coverage, cost control, and health, and improves health by creating a very happy society. Considering additional commitment of higher taxes and longer waiting times, the public health benefits outbalance any challenge that may have already emerged. Public health systems are much more equitable, efficient, and effective, providing healthcare. An advantage claimed by the private healthcare system is personalized care. Patients can choose their healthcare providers and have tailored services. Yet, this is a privilege that's just people that can pay for it, for people that can pay for it. The uninsured or underinsured people still struggle to find affordable services with high quality care due to their financial situation. Public healthcare, such as Italy and France, provide the same advantage for a zero of the cost. A study by the World Health Organization states that the United States distributes 17% of its GDP to healthcare, while Italy invests only 10% of it, but achieves better results. This number highlights the inefficiency of a system that leaves millions of people underinsured or uninsured. The COVID-19 pandemic revealed the strengths and weakness of both public and private sectors. Countries with universal or hybrid healthcare models, such as Germany and the UK, have a better outcome compared to the private ones. The US, the country that everyone thought was the most prepared to this world problem, found himself be the worst one. Due to his fragmented private healthcare system, many Americans delayed going to see a doctor. Despite the preventive measurements such as banning every flight from China in January 2020, or trying to find ventilators and masks to private companies, the US struggled to contain the virus. At the end of March, they were forced to declare lockdown in some states such as California, and in April of 2020, they registered 1 million cases and 60,000 deaths. On the other side of the ocean, we have United Kingdom, which was the most prepared country in the world. Under the Prime Minister Boris Johnson, they decided to lock down the whole country for a couple of weeks to secure hospital space, ventilators, masks, from private hospitals. By the end of April, the United Kingdom registered 80,000 cases and just 10,000 deaths. Countries with robust public healthcare systems demonstrate their capacity to respond effectively to crisis, ensuring that care was accessible to all of them. The access to healthcare is not just a matter of personal being, but a matter of justice and equality. For too long, millions of Americans have lived in fear, not for their illnesses, but for the financial ruin that could happen if they choose to cure themselves. But what if there was a way, a bridge between private and public sector that ensure healthcare is available to everyone? It's called public-private healthcare partnership, and gives a promising solution to this problem. The World Economic Forum said that this collaboration combines the efficacy and innovation of the private sector with the equity mission of the public one. Countries like Sweden are already using this partnership to improve the access, reduce the cost, and guarantee a better outcome later. But political reform would be essential to make this vision a reality. Politics must prioritize public health over profit and passing laws that encourage this partnership. Let me leave you with one final story that impacted my life directly. In Italy, one of my childhood friends, Marco, was diagnosed with leukemia at the age of 13. His parents didn't have to worry for any of his medical bill because Italy took care of it. Thanks to Italy, today Marco is almost 19. He's studying cancer-free and he's studying to become a doctor himself, a dream that he would never accomplish if it wasn't for a universal healthcare system. It should be mandatory everywhere, especially in a country wealthy and advanced like the United States. The path would not be easy, but we owe it to Susan, Anna Maria, and every other American that died because they couldn't afford the medical help that they needed. Assistance are prioritized life over profit because staying alive should not depend on how much money you have in the bank. Thank you. Wait, that's actually perfect.
What does it say?
21 minutes.
Nice.
But we talked for like the first 3 minutes.
Yeah, I think you're within perfect range.